Good evening, my name is Dr. David Doman, and welcome to another edition of Housecall. Why is Black maternal issues becoming a growing issue in Montgomery County? Find out more right now. My guest this evening is Councilwoman Laurie-Anne Sayles. Welcome to Housecall.
Thank you, Dr. Doman, for having me to discuss this very important issue.
It is an important issue.
Yes.
Before we proceed, tell our viewers briefly about your professional background.
Of course. So I have a bachelor's in public health, a master's in public policy, and I've worked at some of our nation's top research institutions, including the National Institutes of Health and the Food and Drug Administration, and spent a big part of my life in the pharmacy as well. And so feel very comfortable talking about health disparities and the social determinants of health.
Good for you. So how is it that you at least somewhat shifted your focus away from those worthy endeavors and went on to politics?
Well, it's an interesting story. While I was on the campus of the University of Maryland, College Park, obtaining my bachelor's degree, I studied abroad, and it was around the time of President Obama becoming elected. And when I studied abroad and learned about some of the marginalized populations in some of our underserved communities in third world countries, I started to think about the opportunities that awaited me back home and how important it was for me to get involved in not just the local issues, but state issues around issues that mattered most to me. I was also a single mom, and so wanted to ensure that, I was a good role model for my daughter and showed her the importance of speaking up and being engaged in the community. We lived in affordable housing and benefited from so much from our local government, and I wanted to play a role in shaping it and ensuring accessibility, equity, and ensuring that it was an inclusive place for anyone who wanted to play a role in shaping the future of our community.
Good for you.
Thank you.
So, certainly as a physician, I am very troubled that in the wealthiest country in the world, the USA, and arguably one of the most affluent counties in the country, Montgomery County, that there is a real growing concern about Black maternal health issues. So share with our viewers the scope of this problem locally and nationally. How bad is it right now?
It is very bad. While I was on the campaign trail, we all heard about the rollback of Roe v. Wade. So we knew that the systemic issues that were associated with maternal health were going to impact women of color even more. So my first order of business, we are all allowed to have 1 to 3 reports commissioned by our Office of Legislative Oversight. I was sworn in November of 2022, and my first order of business was sitting down with our Office of Legislative Oversight and asking them to commission a report on the status of Black maternal health. I serve on the Health and Human Services Committee with the County Council and the Economic Development Committee, and so barriers to care include socioeconomic status. We already know that Black women make 40 cents on the dollar compared to their white counterparts, so we're already facing not just systemic health disparities, but also economic disparities, and that can also impact birth rates, maternal morbidity, and mortality. And so when you think about all of those factors, systemic racism in healthcare, bias in the labor and delivery room, and complications with pre and postnatal care, it doesn't bode well for Black women in the healthcare system. And they had a national study on this in the Washington Post. And so I wanted to see how we were doing at home. Most of our budget, our $7.5 billion budget, goes to safety net services across the health and human services. And so wanted to see where there were gaps, where there were opportunities, and how we could improve outcomes for Black mothers here in Montgomery County.
Give our viewers a sense, though, how bad are the numbers nationally?
So nationally, we are seeing that Black women are having 3.5 times more likely to result in deaths for their children. Black mothers are more likely to have children that don't survive past the age of 1 over their white counterparts. We are seeing that Black women are 20% of our birthing population, yet are receiving, 40% of the C-sections. And we know that that increases complications in labor and delivery. And then if there's not a good support system postpartum, it's harder for women to recover from pregnancy. We have seen, big names like Serena Williams, who felt like she wasn't listened to in the labor and delivery room and almost hemorrhaged. So it's very important for Black women to feel empowered and feel comfortable with their healthcare providers and be trusted when they express complications or fear or pain. And historically, Black women and Black people in general in the healthcare system have had inherent mistrust with the healthcare system. They're less likely to participate in research studies. I was part of the Human Genome Research Institute's study on looking at the human genome and engaging with Black residents to better understand, why they weren't participating in these studies and actually convincing them to get these holistic, physicals to assess, some of their genetic makeup and their, the possibility of them, having targeted medications and treatments to their genetic makeup. And so now that we have, precision medicine, we need to ensure that more people are getting involved in some of these research studies.
That was a terrific reply from which many more questions are going to cascade.
Yes.
So let's start out by asking, and focus first on Montgomery County.
Yes.
You mentioned this is a big problem nationally. However, we are in a county that is very affluent, and I like to think is far more attuned
definitely
to societal needs than other parts of the country, in particular the Deep South and the Midwest. How is it possible in a county like Montgomery County that we still have these issues?
Studies show that regardless of income level, education level, Black women are still either not surviving childbirth or experiencing more complications during childbirth, or their babies aren't surviving. And it's systemic issues, whether it's because they don't have access to midwives or doulas, the supportive systems within labor and delivery, and the important care pre and postnatal. Are they mindful of the complications of, high blood pressure, diabetes? And so if they already have these chronic diseases, how is that contributing to their family planning and their entire pregnancy and then delivery? So what we've tried to do here in the county is create preventative programs to have home visits and ensure that throughout the pregnancy, once you determine that you want to start a family or grow your family, that we try to have those supportive services available to our families.
Thank you for sharing those statistics with us. In terms of some of your other comments, you mentioned African American women are historically reluctant to participate in research studies.
Yes.
And I would imagine some of that goes back to the Tuskegee syphilis experiments.
Definitely.
As well as the very sad story about the Hella strain out of Hopkins, which was a diagnostic tool that was developed at Hopkins, unbeknownst to an African American woman, and it was commercialized. So many millions of dollars were made without the family even being aware of it.
Oh, yes, yes.
So I think that all contributes to that historic reluctance.
Yeah.
In terms of the many things you mentioned, what about the shortage that is now unfortunately growing of African American physicians?
Yes, yes. You know, it's funny you mention that. My daughter is, entering Salisbury this fall to become a nurse.
Very nice.
She started out as a communications major, and now she's going back to school to get her nursing degree. But we are seeing better results and outcomes when we have culturally competent care. What we saw during the pandemic, we saw more Black men were experiencing mental health complications and trauma, needed access to care. So while the pandemic was certainly a challenge for us, there were a lot of things that were born out of that. And one is the Black Physicians Healthcare Network. We now have a network of Black healthcare professionals that our residents can access, whether they are underinsured or uninsured. And then our HBCUs are so important to training
historically Black colleges
and universities. Yes, they are, so important to training the next generation of healthcare professionals. And then also ensuring that any healthcare professional has the cultural competency across the spectrum to ensure that whoever comes before them, they're able to eliminate bias. We all have bias, but in healthcare, it's, between life and death. And so we want to ensure that they are receiving regular training and also encouraging pathways to complete that degree as well.
I certainly understand, and I'm very concerned that the relative lack of African American and Latino physicians makes it difficult for patients to feel comfortable, particularly when it comes to maternal visits. It's a very personal matter. Many women are reluctant to discuss these topics, and having any sort of cultural commonality is very important to have that doctor-patient connection.
It is, it's very important to have that comfort level, that lived experience. I'm the daughter of Jamaican immigrants, and it's important when I seek out, healthcare professionals that, whether it's, do I need a woman for a certain, health concern, or do I want an African American? Do I want someone who has the same religious background,
Sure.
And so I remember during one of my externships at Kaiser, part of my externship was actually evaluating the cultural competency of labor and delivery staff and ensuring that the staff has the proper training and also ongoing training to model those cultural competencies in the delivery room.
Excellent reply. We're going to pause briefly for a public service announcement. More with my guest, Councilwoman Sayles, in a moment. We'll be right back.
Love is a lesson that doesn't end. It knows no conditions, so you better buckle in. Love keeps you on your toes. It never stops, only grows. Love isn't easy. It's a commitment, especially when they're being their most resistant. Love is being prepared for the journey ahead. Love doesn't let any concerns go unsaid. Love is finding the right seat so you can take a breath. But remember, love isn't lax. It always double checks. Check that your kids are in the right seat at nhtsa.gov/the right seat. Love protects.
We're back. My guest this evening is Councilwoman Sayles, and we're discussing the troubling local and national trend of increasing Black maternal health issues. When we paused for the break, you made the forthright case that it was so important that there be adequate number of African American physicians and nurses to care for members of the community.
Definitely.
So I think a perfect follow-up question is the very troubling trend coming out of the Trump White House to viciously attack DEI initiatives, diversity, equity, inclusion.
Yes.
That, if anything, is going to reduce opportunities for Black physicians and nurses. So how do you reply?
It's troubling. You know, I look at this big, ugly bill and see how it's going to hurt the lowest among us, the people who are struggling already to make ends meet, the people who rely on the social safety net services like Medicaid, like food stamps, and access to quality health care. So it's very troubling. You know, there was a recent report about the number of Black women who have left the workforce due to the federal cuts, who are being pushed out of corporations because of the threats of DEI, losing government contracts. Even the comptroller put forth a report last year about the impact on Black women in the workforce and how childcare coverage and expenses are already barriers to accessing, you know, quality jobs. And if you don't have a job, it's already expensive, even if you are, you know, able to access the Affordable Care Act's insurance marketplace. And so we are bracing for the impact that is going to have a reverberating effect and impact on our community. Luckily, here in the county, you know, as I mentioned before, the pandemic has prepared us for the worst. We now have mobile clinics that are available and accessible to many parts of the community that don't have access to healthcare. Places like Poolsville, Up County, that has one healthcare provider for the entire community. Places like East County, they will now not just have access to the clinics, but also access to the mobile clinic. We've also empowered our nonprofits to stand up clinics on the weekends and to diversify the care that they're offering to ensure that we're meeting the immediate needs of our community. And we are also ensuring that our minority health initiatives that, you know, I use our Minority Health Month in April to recognize from, you know, the Asian American population, our Latino Health Initiative, and the African American health population. Programs like our SMILE program, Babies Born Healthy, the Montgomery Perinatal Program. So while we are bracing and preparing for the impacts at the federal level and how it's going to impact us locally, I feel very confident that Montgomery County, in addition to what's happening at the state, you know, even the state has noticed that this is a problem. They are creating a dashboard to monitor statistics across the state for any hospital that performs labor and delivery. And so I am very hopeful for the future that, we are not going to roll back our diversity, equity, and inclusion efforts. That's what makes Montgomery County so great. That's why people move here. It's the cultural fabric of our community, and we're going to take care of everyone in the way that they need to be cared for. And we are going to do it in a racially equitable way as well.
Wonderful. However, one of my other concerns is America's uninsured. As a physician, I've always been deeply troubled about that. And now with the White House successfully passing the ironically named Big Beautiful Bill, in order to offset the cost of reducing tax rates for the mega wealthy, potentially it is projected by the General Accounting Office, which is nonpartisan, between 10 and 15 million Americans will be returned to the uninsured rolls.
Yes.
So what say you to the reality that with a limited budget, you will now have a tidal wave of millions of Americans, many of them living in Montgomery County, who won't have health care coverage?
I see it as a pattern of negligence, abuse, a dereliction of duties by the Trump administration. Under his first term, we had over 1 million deaths related to the pandemic. And now we are going to experience a new wave of deaths. We are anticipating almost 20,000 deaths from the Associated Press, just related to this bill. We don't know when we will see these deaths, but it's concerning, it's scary. We are troubled by what's going to happen with this bill, and on the ground, the local level has always been closest to the people. We are going to take care of as many people as we can. That's why I'm a huge proponent of ensuring that our nonprofits are funded, from giving funds to our Muslim community and the American Diversity Group that hosts, all sorts of screenings, and again, standing up resources for our health initiatives. My background in public health teaches me to focus on preventative care and accessibility. And so from ensuring that people now have free transit to get to appointments, funding our dental care system, because we know how important our dental care is to ensuring our nutritious health and our overall health, from our Office of Food Systems Resilience to ensure that everyone from our youngest children to our seniors who are isolated or sick and shut in, we're going to take care of our residents here. And I am confident that our governor and the state feel the same way. And so while we are feeling like an island and left behind in this big bill, we also have a federal delegation that's going to fight tooth and nail to ensure that residents here have what they need. And so I am very confident in our providers here in Montgomery County and across the state. And we're going to ensure that whether it's increasing the languages that are available to tell residents about the healthcare resources that we have, ensuring that our minority health programs are setting up tables at our farmers markets and all of our community events. We are going to take care of home because that's what we've always done. Montgomery County has always been a model for other communities, and this is a time where we're going to have to stand up and be leaders in this space. And as the council's lead for eliminating disparities in public health, I'm very disappointed that I have to embrace this role, but confident that we will have the resources that we need to safeguard our communities.
Very, very good. So if our viewers have any questions about the topics we've covered today, how can they reach you?
Well, they can go to our website at the Montgomery County Council, and I represent every resident across the county as an at-large member. They can email me, they can set up a meeting if they have questions, and they can always find me in the community. You know, I signed up for a full-time job, and I know, you know, what comes with that, and so I'm always open to ideas and addressing any concerns as well.
Very nice. Thank you for joining us on Housecall. Now, I did tell you before we started the taping that, unbeknownst to you, we were kindred souls.
Oh.
And I wanted to share with you a little background there. One of my passions over the years has been America's uninsured. I'm very concerned about that.
Yes.
A number of years ago, I published a book called Heartbeat. And briefly, it's about an African-American librarian in LA who's dying of end-stage heart disease.
Wow.
And it turns out that there is a procedure that can save her life, but unfortunately, because of budgetary reasons in LA, she lost her health insurance. So she becomes the lead plaintiff in a class action lawsuit,
Wow.
all the way to the Supreme Court, demanding health care for all Americans. Now, you may wonder if she lives or dies, or whether or not she wins her lawsuit. But I suppose you'll have to read my book to find out. So, with that as a background, here's a copy of Heartbeat.
Oh, thank you, Dr. Doman.
With my pleasure.
We have a lot of work to do,
Yes.
and healthcare for all is certainly a way to ensure
Well,
accessible
I think
quality
in the wealthiest
care.
country in the world, healthcare should be viewed
excuse.
as a fundamental need and not a luxury.
I agree.
And certainly many European countries provide universal health care, and I've never understood why can't we.
Yeah. Why can't we feed our residents? Why can't we nourish our residents when water's free and, you know, we can grow food? So there's no excuse. It's just the will to do what's right.
Absolutely. Absolutely. So my thanks to you for an excellent interview.
Thank you, sir.
My thanks to Councilwoman Sayles for a very informative and troubling interview. My thanks to my team here at the studio, and my thanks to you, the viewer, for joining us this evening. If you have any questions, you can reach me at the website listed on the bottom of the screen. As for our next show, it's going to be a very interesting one. Dr. Kathy Sata, an authority on management of long-term COVID, a growing problem locally and nationally. She will be my guest, and she'll be discussing the challenges and new therapeutic opportunities for this problem. See you then next time for another edition of Housecall. Good evening.